Good morning. Thank you for joining us for our webinar, Maximize Impact with a Comprehensive Communication Strategy. We will be starting in just a few minutes. Throughout the webinar, we will be asking you questions via polling pods and discussing your responses, which will be reported only in aggregate. So before we get started, let's practice with a couple of easy questions. You should now see two poll pods above the webinar graphic. On the left, please enter the state that you're currently in. On the right, please select the number of people in the room watching the webinar with you. If you have any questions or technical issues you need help resolving, please type them into the Q&A pod on the right. We will leave some time at the end to answer questions. Thank you. Good morning. I'm Derek Hirsch, a project leader with the Rural Health Transformation Center. Thank you to those who participated in our test polls. I'm excited to see we have attendees from all across the Midwest as well as in California. We'll have other polls pop up throughout the webinar and appreciate your participation. Feel free to enter questions into the Q&A pod on the right at any time. We'll leave some time at the end to answer questions. This is the first of 3 webinars in our series, From Sticking Point to Tipping Point, Overcoming Rural Community Health Improvement Challenges. In each of our free interactive webinars, we'll show you how to begin solving a specific rural community health challenge and offer you valuable tools and resources that will help. This webinar is being recorded, and you will be sent a link later this afternoon to view and share it. Now, on to the main event. Maximize impact with a comprehensive communication strategy. Developing a comprehensive communication strategy, transitioning the mindset of a community, or improving the food and built environments to support healthier choices can all be challenging, but the process doesn't have to be overwhelming. With many of these challenges, a process of small but proven, well-choreographed steps can begin to tip the scales in your favor. Throughout this webinar, you will learn the key steps necessary for impact. These steps were critical in achieving a 94% brand awareness in just the first year of our 10-year Rural Community Health Initiative, the Heart of New Ulm Project, and maintaining brand awareness at 90% throughout all 10 years. Here to walk you through these steps and more is Rebecca Lindberg, the Senior Director of Population Health, Education, and Communications at the Minneapolis Heart Institute Foundation. Rebecca, the floor is yours.
Great. Thank you, Derek. And thank you all for joining us today for this first in our three-part webinar series. We're excited to share what we've learned, as Derek said, in our Heart of New Ulm project over the last 10 years. So to get started, I am guessing that most of you on the call are working on improving health in some capacity. You may be working with an entire community or a smaller defined population of patients, or possibly even an employee group. And as we all know, to inspire behavior change can be very challenging. And it's easy to get stuck. Maybe our efforts are stalling out, or they lose momentum, or not being able to really inspire the change that we're looking for and making strides to the health improvement that we hope to achieve. So why is it so difficult? Well, we're competing with a lot, and the people we're trying to reach, their attention is scarce. And it's been said that we're competing with about 5,000 other ads and messages that people are seeing and hearing and dealing with every day. That's 5,000. So we're trying to cut through a lot of clutter to get our messages heard and seen. And it's not just enough anymore to tell somebody to change a behavior. I think all of us that are working on behavior change realize that there's a lot of influences and impact on why and how somebody makes a health behavior change. They could be influenced by their schedule and the barriers that come with being very busy. Or maybe it's the availability of things in their environment. Is it easy to walk or bike? Is it easy to find healthy foods? And how do they know it's healthy? The communications that we share and disseminate make a difference. And we know that taste and cost is a big influencer on why people make the decisions that they make. And then whether their friends or family are doing the behaviors. And of course, other messages come into play as well. So over the next 35 minutes or so, we'll discuss our recommendations that have come out of our 10 years of experience working with a rural community in Minnesota. We've been working to improve the health of that community, but also along the way measuring the impact that we are having. During our process, we have applied many behavioral and social learning theories and models to the work that we've done. But what we really want to talk about today is less about the formal theory and more about what we found helpful to advance our work, what we've learned, some of the lessons that we've come across during our process. We want to talk about what worked for us, but also share some things that didn't work so well for us. We'll discuss not only what we've done right, but also those things we've done wrong. And hopefully you can take these lessons and apply them to the work that you're doing. Whether you have a big communications team, a large budget, or are really working with limited resources, I think you'll find some tips that you can use during your health communications work. And during our conversation, we hope you will discover the value of penetrating a community with messages throughout the community. We hope that you'll identify gaps in your current communication strategies, and by doing that, you'll be able to find ways to advance your work. And we hope that you'll use the assessment results that we'll be walking you through to accelerate your community health improvement efforts. So let's start by level setting. What is health communications? It's the use of communication strategies to inform and influence individual and community decisions that enhance health. So it's a little different than normal communications. Although we're trying to have a person take action, this is really about having them take action to improve their health. And on the right of your screen, you'll see the health communications cycle. This is a cycle that we used, and we'll walk through how we did it. But it really starts with the importance of just thinking of health communications as a strategy. I think so often as we're working with other communities, we have heard people think about communications way later in their process and thinking about it more as a channel to get the word out on the initiatives that they have going on, and less about a strategy in and of itself. We'll talk about pre-testing concepts, messages, and materials, and the importance of that for success. Implementation is important, but also the assessment process and the refining of your messages based on what you're learning. So we're going to move to poll number 1 and get a little insight from you. What are your communications challenges? Is it limited or no dedicated staff to communications? Possibly it's a limited or no budget. Lack of dedicated or integrated strategy. Lack of buy-in from leadership for communications. Lack of communications expertise on your team. Or maybe you have some other challenges that are getting in your way, and we'd love for you to answer that in this chat section. Well, it looks like limited or no dedicated staff and lack of dedicated or integrated strategy are coming out on top for people today. And that's understandable. And I'm hoping that as we move through the presentation, that you will find some valuable information that will help with some of those challenges. So as Derek mentioned in the introduction, we have been working on the Heart of New Ulm project since 2009. And this was a 10-year research demonstration project to improve cardiovascular health in a small rural community in southwestern Minnesota. But it's really given us the opportunity to be able to test our communications strategy and learn from this large-scale community health improvement initiative. When we began to think about this work in 2008, we looked into health improvement projects that came before us. And what we've learned, and what was one of the consistent recommendations from those projects, such as the North Karelia Project, the Minnesota Heart Health Project, and the Stanford Community Study, was that a comprehensive communication strategy needed to be a big part of our overall community health improvement strategy. So when we initiated this project, that became a priority for us. And I think, as Derek mentioned some of the stats, we did have success right out of the gate and achieved a 94% awareness of our project and the work that we were doing within the first year of the project. And we're able to maintain greater than 90% of awareness of our project over our 10 years working in the community. So how did we get started? Well, first, we needed to understand what the health needs were in the community. And our community diagnosis looked like this. 76% of adults were either obese or overweight, exceeding the national averages. 38% of adults had metabolic syndrome, which puts people at high risk for coronary heart disease and diabetes. Only 17% of adults consumed the recommended 5 fruits and vegetables a day. only 64% were meeting the minimum recommendations for physical activity, and there was a significant underutilization of preventive medications. So this was important for us to understand because these really formed the basis for the decisions about how we were going to set up our communications strategy moving forward. The next step in our process was really understanding who exactly are we trying to reach. And I think in our work with health communications, this is probably one of the most challenging pieces for people to understand and to really distill. And I think it's because we're really in a helping industry and we don't want to leave anybody out. Of course, we want to help improve the health of everyone in the community. But unfortunately, when we try to speak to everyone, we're really speaking to no one. And everyone is not our customer. So it's really important to distill down exactly who your target audience is. So we had a primary target audience, and our primary target audience were the residents of New Ulm who were 40 to 79 years old and who lived in the zip code 56073. So very specific. But we also had secondary audiences because we knew that to be successful with our community health improvement efforts, we really had to have the buy-in and we really needed the expertise of our community stakeholders. They were the influencers in the community that were helping build our project and get the communications out about the work that we were doing. We needed and wanted support from the professional community because we were not only just trying to improve the health of New Ulm, but we were researching it as well. And then we were funded primarily from philanthropic dollars, from grants, and so we needed to also be messaging and communicating with our funders. And as that was our target audiences for the overall project, every initiative, communications campaign, program that we were rolling out during the Heart of New Ulm project, we really distilled that target audience and refined it, distilled it down. So for example, if we were working on weight loss, we had a project that was a swap it to drop it campaign. And our target audience was not only the adults 40 to 79 years old, but they were also interested in making small changes to lose weight. So that's just an example of taking each of our campaigns down one step further. The next step in the process is to define your goals and objectives. Now, our overall goal for the Heart of New Ulm project was to reduce the number of heart attacks over the 10-year period in the community. We kept that visible in our communications, but really our efforts to move towards that goal were communicating and building programs and initiatives around the modifiable risk factors for heart disease. So things like elevated blood lipids, high blood pressure, obesity, physical inactivity, low fruit and vegetable consumption, etc. We target our initiatives here, but we also targeted our communications across the community. The other thing to think about as you're thinking about your goals and objectives is what do you want the person to do? Is this an area you're just trying to raise awareness? So when we initially started our project, more priority was set in raising awareness. People didn't know about the project yet, and so we needed to put more effort in just getting the word out about the project and why we existed and what the overall goals and objectives were about the project. But as people started to understand who we were, we wanted to start then increasing knowledge. So our communication strategies changed. as we continued to move on, we would looking at how do you communicate to really impact behavior change. And then as our secondary audiences, our key stakeholders across the community, we were also looking for ways to communicate with them in a way to inspire advocacy. We needed other people on board to own the work so that we were building capacity in the community to do this work well. So we're going to move to our second poll. And we'd like to understand who in your organization is responsible for communications. Do you have a dedicated communications team that's supporting your work? Or possibly you only have one dedicated communications staff? Do you have a dedicated communications staff, but they work across your entire organization, so they're competing and don't have time to only spend on your initiatives? Or possibly your community health team members are responsible for the communications. Or you don't have any communications staff a part of your strategy. So it looks like you do, most of you have some dedicated communication staff, but they work across your entire organization. And then a lot of you, your community health team members are responsible for your communications. And I would say we did have a communications consultant that was helping us with our project, but a lot of the communications work that we'll describe in the rest of the webinar, a lot of our team actually did that work as well. So you do not need complete team to be able to do this work, start this work and do it well. So when we moved into New Ulm and started working on our project, we knew it was very important to build that awareness that we needed to create a consistent brand. So we started with a very consistent brand that the community actually had insight in helping to build. So I think that's one place for everybody to think about. Do you have a consistent brand that you are rolling out in your community? Now, throughout the 10 years, I will say that as we rolled out different grant projects, different programs in the community, as we were testing the concepts of those programs with our residents and our targeted audiences for those programs, we did test the concept of rebranding, repackaging different programs with a different look and feel. And our community was very clear. The residents said, nope, you need to keep it under the brand that we recognize and we trust. So I think that was a good message of the importance, not only for the work that we were doing, but the importance for the residents as well. This was a brand that they knew and they trusted. So the next step is really to think about tailoring your messages to reach your target audiences. And I think this is key because I think so often we put together communication pieces and we try to share the same communication pieces with all our different target audiences. And you really need to refine those down. We usually start by doing a literature search to see if there's any evidence-based information available that can help us frame up our messages. And then we pull together a group of experts to help us define key messages and priorities and also the actions that they would like to see the target audience achieve to help us reach our objectives. But I will say the important thing to keep in mind as you are putting together your messages and tailoring them to your target audiences, that it's not about us. And the reality is we're not our target audience. So that really leads, I think, to a very important next step that it's really about the value that we're bringing to our target audience. We really need to consider what their desires are, what their needs are, and how they want to receive messages. And to do that, it's really about listening to your community. It's getting in front of them, and it's testing those messages with your target audience. And we did this not only with large scale communications campaigns or programs, but we did this with small communications efforts as well, because we really wanted to understand how our target audience received these messages before we put them out into the larger community. And I know many of you said that you were limited in your communication support, and I just want to emphasize that we did this in a number of different ways. I think you can think about formally testing your messages in focus groups, which we did. Most of our focus groups were part of grants that were funded, and so we got funding to do this. But we did recruit throughout the community in a variety of different ways. We did very formal focus groups where we did ads in paper, the newspaper. We had people call in who were interested in participating. We screened those individuals against a specific criteria to ensure that we were getting the target audience into the room. Oftentimes we provided incentives, but I will say the incentives did not have to be very much. People showed up, in the picture that you're looking at here, people showed up for dinner or a cookbook or a small gift card of $25 or less. They really wanted to participate and help inform the work that was happening in the community. So the focus groups that we did didn't have to cost a lot, and they were conducted by our health improvement staff. So our population health team did all the focus group testing. But again, it doesn't have to be a formal focus group process. We also used informational interviews. Sometimes, depending on the project or the work that we were doing, it was easier to go one-on-one and do informational interviews than it was to pull a large group together. We also learned a lot from our community through resident surveys, and that helped inform our communication strategies. Some groups were resistant to more formal research processes, and so in some neighborhoods, to get information, we did community gatherings where we hosted a social event and had residents come to those social events and then did fun data gathering or information collecting about their needs, about their reaction to different messaging and communications that way. Or if your budget and time is really limited, and we did this often, we did more informal testing. Think about your target audience, who are you trying to reach? And then think about your neighbors, your friends, your colleagues that might fit into that target audience, and get your messages and brand in front of those people, because they can give you a lot of great insight and a lot of great data. So again, message testing important, communication strategy, brand. It's great to get the input of your target audience, and I think it's imperative for success. I think you'll have more success with your campaigns and the things that you're trying to do if you do this process, but it doesn't have to be costly. So when we talked to people and we were testing things, these are the type of questions that we asked in that process. If it was a communications strategy, what is the message that they are hearing? And sometimes it wasn't what we were trying to get across. So I think it's important to understand how they're interpreting what you're trying to communicate. What appeals to them or doesn't appeal to them in a message? Also testing your visuals. Is that something that appeals to them? Does the message make sense? Why or why not? Is the message believable? Oftentimes we'd test a message that we thought was great, but it wasn't something that the target audience really believed or they really thought was doable for them. Would they act on the message? How does the message make them feel? Where would they expect to see this message? So talking to your target audience about what channels that you should deliver a program, that you should deliver a campaign. It's important to know where they would want to receive that messaging as well. So I want to walk through a couple examples with you. And this is one that just came up last week. So it wasn't about our Heart of New Ulm work, but this was another group that we were doing some messaging testing here with our women's heart health work that we're doing. So the message that we were asking some patients and family members about was the number one killer of women is still at large. Heart disease kills more women than all forms of cancer, Alzheimer's, and respiratory diseases combined. We need to reinvest in research that prioritizes women. We wanted to understand their immediate reaction. Does this message make them feel like something that they would motivate them to take action? Why or why not? And ideas for improving the message. Now, I will remind you that we pulled all our experts together and framed up these messages and edited these messages. So we felt pretty good about the messages going into this message testing experience. And we were surprised that the words at large really resonated negatively with our target audience. They thought of rapists and murderers on the run. So I think it was really important for us to understand that before we distributed this kind of communication more to more people. Because if our community is stopping at the word at large, they're not hearing some important facts which they really highlighted as things they thought we needed to get out, was that heart disease kills more women than all forms of cancer, Alzheimer's, and respiratory diseases combined. So they were stopping at large and weren't reading further. Another example, we ran this campaign, Swap It to Drop It, and it was about saving 100 calories a day to drop 10 pounds in a year. It was a simple campaign. People loved the idea and the concept of it. They helped us pick the logo that, again, matched our brand. And then we tested messages with them. And these were messages that we had our dietitians that are on staff put together, key messages around the behaviors and the actions that we thought were important for people to take to actually reduce the modifiable risk factors for heart disease. So this was one of those messages, really thinking about simple 100 calorie swaps of a leaner meat from a higher fat, higher calorie meat like pepperoni. And as you maybe are thinking yourself, that's a terrible message. That looks nasty, nasty, nasty is what we got from our target audience. It was really not the message, like the message of substituting the Canadian bacon for the pepperoni, but it was more about the visual appeal of this message that did not resonate with people. We heard things like, "What is that? That is really disgusting." So another message, just to give you an example, again, designed by our team of dietitians, tested it. This would probably be a pretty common message that you might see, swapping the salad in place of French fries. And with our targeted audience, we heard a lot of things we didn't even consider. You can't eat a salad while you're driving, but you can eat French fries. That is a pretty big swap. That might be good for somebody who's already making the healthy choices, but not for me when I just go to fast food occasionally. We heard a lot about affordability with this message. that it is too costly to make that swap. So they thought of this message as deprivational and not doable. So it might be a message that works with a different target audience, but for who we were targeting, this message did not resonate, and it was one then that we didn't use. Next, it's important to think about how and where you will deliver your message. What channels will you use? And again, I think this is important to test with your target audience. When we were designing interventions for the Heart in New Ulm project, we were using the social ecological model, which is a prevention framework that considers all the complex influences on overall health. So we were really trying to intervene across the community, not just on an individual level, but organizational, community, and looking at policy systems and environment approaches as well. So when you're thinking about your communication strategy, you want to think about it in alignment with your intervention strategy. And do you have communications approaches that are working in alignment with that? The other thing we thought about is we really wanted to communicate to people where they were at. So how do we communicate our messages at home? Through things like direct mail, through the newspaper, through cable TV. We thought about, okay, on the road, through radio and billboards, work sites, our clinics, online, websites, social media, email, community. When people are in the restaurants, the stores, schools, chamber of commerce, the churches, we want them to be seeing the same messages no matter where they're at. The more they see them, the more likely they are to resonate, and the more likely they are to take action. Now, I will say, I think maybe you're looking at this and thinking about some of your challenges with lack of support, possibly, not a lot of communication support, and budget is probably another issue that comes to mind. I will say our partners really helped with this. So, for instance, with the newspaper, with some of our grant-funded projects, we paid for ads in the newspaper, but by developing that relationship with the local newspaper, they were willing to then print our press releases and print articles we wrote for the paper for free. So that relationship we really leveraged. In New Ulm, their cable access TV has free opportunities for messaging and advertising that we partnered with them on. Radio, there are free shows that our staff was able to be on to promote and to communicate some of our messages, but also some of our key stakeholders in the community had their own shows that they were willing to communicate the work that was happening through their own radio shows that they had. So think strategically. It doesn't have to cost a lot. You can use similar messages across, which I do think resonate well. And it doesn't take as much staff if you're leveraging your partners in the community as well to help you do this. So here is an example of a billboard that we used with our Swap It to Drop It campaign. We were surprised that before this, we weren't thinking that billboards would be such a popular place to communicate. But what we learned by talking to our target audience was that they do notice billboards in the community, and there were certain ones that were especially seen as a priority for promoting our messages. So throughout the 10 years of the project, we probably had billboards up most of the time during that 10-year process. Also, communicating messages, and as you think about the channel, the one thing we heard from our group was that in our target audiences is they want to see the messages where they're most appropriate. So for instance, the French fries, which we changed from swapping the salad for the French fries to a small fry for a large fry, which was a more acceptable and doable message for our target audience. And that message then was communicated through our restaurant program, because it didn't make sense to communicate it in the grocery stores or the convenience stores or even at home per our target audience, because that's not where they were making those choices. So again, here's an example of the same program, Swap It to Drop It. We did a lot of experiential learning as part of our communication strategy. And this was some taste testing that was going on in a grocery store in New Ulm. And then again, that same campaign, those messages were distributed in a convenience store. So just wanted to give you an idea how you can take a campaign, take messages that have been tested and disseminate them across the community, all during the same time period to have more impact. We used in our communication strategy, what we heard from our target audiences is stories are important for impact. So we did casting calls for some of our campaigns. Swap It to Drop It was one of those, where people could share stories about how they lost weight by making very simple, small changes in what they were eating or their physical activity. We also profiled stories of our key stakeholders, so our partners in the community. And by profiling them and giving them promotion, they were more likely to continue to work with us. And then as our campaigns were more successful, it got other people wanting to get involved. And so our schools wanted to leverage what was happening around things like our Swap It to Drop It campaign. So we worked with the student council at the schools to roll out a Swap It to Rock It campaign and promoted healthy foods at tailgates and concession stands and used their coaches as influencers in the community and encouraging both the adults at these events, but also the kids to make healthier choices. And again, the student council helped us roll out this campaign. So it doesn't always have to be your staff doing the work, but really thinking about how you work with your communities to help you do this. I mentioned before, we really need to tailor our communications in how we speak to our different target audiences. So we really used our data to not only share where we were at in the project, but really to help encourage and influence continued change in the community. So how we communicated that data to residents was very simplified and in a way that resonated with them. But it was different for some of our community leaders who wanted more in-depth data about the interventions that we were doing, why we did them, what was some simple messages about the approaches that we were taking, what were the health outcomes that we found, and then what is the success. So these fact sheets are available on our website, but these are examples of things that our community leaders, then we could arm them with the data from our program, and they could then share that data with the groups that they were working with to have more influence. At the same time, we were communicating to our scientific community, and you can read more about the in-depth work of our project. We have 21 peer-reviewed articles published that are available. The links are available on our website, and 18 poster sessions, and we've given presentations around the country as well. The funders, especially as our project advanced over the 10 years, we had to continually communicate our progress with our funders, as well as look for ways to get additional funding to support the work that was happening in New Ulm. So we really realized that the way we communicated to our residents and our stakeholders, our funders, were looking for different things. So we took that same data and repackaged it in a way that resonated with our funders. And then, of course, it's important to measure progress along the way. I think that helps inform if you are heading down the right path or you need to pivot. And then, of course, the impact at the end of your interventions and your communications campaigns. I think you want to understand, did the communication, did it reach the targeted audience? Were your objectives met? Was the communication channel the best place and the best choice for distribution? What was your reach and engagement, and did you reach your goals? Did the message inspire the desired behavior that you were looking for? What was the feedback from your target audience? You know, some of that qualitative feedback can be the most important feedback to really help inform the next communications that you do. So we're going to pause here and do our third poll. We'd like to understand, where are the gaps of your current health communications work? You can check all the steps below that are part of your current strategy, and you'll realize that the ones that you haven't checked are probably where your gaps are. This is great feedback. It looks like health communications is a key strategy for most of the attendees, which is wonderful, and that you are identifying communications channels in the planning stage and not later on in your work, which is great. It looks like one of the key gaps, or a common gap for people on the call, are that messages and channels are tested with the target audience. So that could be one gap that people could think about doing. And I will say that we have found that to be invaluable in the work that we're doing. And again, as I mentioned earlier, those kind of that testing can be formal or informal in your process. So just in summary, again, you know, thinking of strategic communications for impact, it's really about understanding your target audience, your communication objectives, determining where and how communications will be delivered. It seems like most people are doing that. Designing that communication, but then testing it formally and informally with your target audience. I just can't reiterate enough how important that is and how valuable it's been, not only in the 10 years of the work that we've done with the Heart of New Ulm project, but in the work we continue to do as a population health team. I think it's really impactful as you move forward with your health communications work. And then measuring the impact of your work, ensuring that you are reaching your objectives and your goals along the way. I want to say that at the completion of this webinar, we have a resource for you so you can kind of think about the steps that we've talked through today. This will be available for download, and you're welcome to use that, and hope it's helpful in the work you're doing moving forward. So I believe we're going to open it up for questions now. Does anyone have any questions? You can put them in the chat box.
All right, here's one. When you're first entering a community, how do you engage those partners right off the bat?
That's a great question. When we entered New Ulm, it was really a process of having informational interviews across the community to understand not only who the key stakeholders were, the organizations that we wanted to include in the work, but also who the influencers were in the community. And I think all of that ties back to communications as well, because you start understanding quickly by doing those informational interviews how people want to receive messages, as well as communication strategies that might work well in the community and ones that may not work well that work well in other communities.
One more. It's come in. How do we get the right people around the table to test our messages?
That's a great question as well. We did this in a lot of different ways. As I said, in some cases, when we had grant funded work and we did more formal focus group testing, we did solicit people for focus groups through advertising. So we used newspaper advertising, radio advertising, defined criteria, basic criteria in the ads, but also screen them to ensure that they were in our target audience. In more informal cases, we defined our target audience, and then we asked people who we knew were in that target audience to either come to a focus group or take part in an informational interview, or even just more informally ask them if we could spend 5 minutes with them and get their reaction to some messages.
One more question here. How did you choose New Ulm, or were you invited into the community?
That's a great question. The Minneapolis Heart Institute Foundation works with a group of physicians, and one of our preventive cardiologists here was not only practicing in Minneapolis, but practicing in New Ulm as well. And he understood that only a small amount of health could be influenced by the work that he was doing with his patients. That really it was about that 80% of influences on our health outside the healthcare system that really had an impact. And I think the stat is on average a physician spends 2 hours with a patient over a decade, and how can that 2 hours really have that ongoing preventive opportunity to impact their health. So he actually was the person who visualized this project and worked with one of our health plans here to kick off the project with some seed funding. So New Ulm was picked because it was a place that he was practicing, but also because over 90% of the population received care at New Ulm Medical Center, and we were using the electronic health record as our surveillance tool throughout the 10 years of the project. So it was a stable community to follow.
Another question has come in. Given budget constraints, how do you convince leadership that communications should be funded?
I think that is a great question. I do think it's the data and it is the experience. So I'll give you a couple examples. I think, tracking impact when you test um, communications and seeing really tracking who you're reaching can make a big difference. Continually sharing that with your leadership so they understand that. I think the other thing is involving them in focus group testing. And in fact, we just did that last week with some of our leadership who understood the concept of target audience and messaging, but I think it really stuck out when they saw the reaction and excitement of people participating in message testing, and how even though we thought we put together really good messages and we had physicians reviewing those, that the patients and the family members had very different reactions to some of the messages that we were testing. And I think involving your leadership in some of those activities, they really start to see the value of the work that you're doing.
And another question. How did you or are you using social media for communications and marketing?
That's a great question. So initially, when we started the project in New Ulm, Facebook was the primary channel that we were using from a social media standpoint. It was the one that the community and the residents were using themselves. As we moved through the project, we added Twitter to that, but we quickly realized that Twitter was really resonating more with our professional audience and other people that were doing this work. So our messaging really was different. What we were sharing on Facebook was more about the work that was happening, things that people could get involved with, getting them engaged, and all the initiatives, campaigns, some of the policy changes that were happening in the community. And Twitter became more of the channel to communicate with other communities doing this work and sharing what we were learning, so it could help advance the work and accelerate the work of other communities. On our population health team, we have just added a marketing communication person who is supporting some of our population health work and comes to us with digital marketing experience. So we are adding those capabilities, but are new in that area. But we're looking forward to being able to do a lot of this message testing and learning from our target audience through some of the social media channels as well. I'm going to hand off the mic. I want to say thank you to everyone who participated in the webinar today. It was a pleasure. We hope that if you have additional questions that you will reach out to us. You can see my contact information on the screen, or please follow some of our social channels that are also listed there. Derek is going to give you some housekeeping items to wrap up here today.
All right. Thank you, Rebecca, and thank you all once again for joining us. You can get more information about the Rural Health Transformation Center and access all of our tools, resources, previous webinars via the link pod that just popped up above Rebecca's contact information. And while you're there, please register for our next webinar, Getting Community Partners Decisively on Board, which will be presented by Cindy Winters, a project advisor for the Rural Health Transformation Center. And that will be on Thursday, June 20th from 11:30 a.m. to 12 p.m. Central Time. And if you have any additional questions or would like more information or specific resources, you can use the top pod to send us any questions, comments, or feedback. Lastly, we would greatly appreciate your feedback via a survey, which will pop up after this webinar ends. Thank you all again and have a great day.